Welcome to the introduction of the Occupational Therapy Pillar, which is a supplementary resource of the Intensive Care Society AHP Critical Care Professional Development Framework. The intention of these pillars is that AHPs have a common language and a consistent approach to their development within the critical care setting. For us as occupational therapists, the pillar is there to help demonstrate and grow our unique skills within the clinical setting, managerially, educationally, and from a research perspective. It can also be used as a tool to identify resources required to support this development. We created the pillar alongside our professional specific resources, such as the RCOT Professional Standards for Occupational Therapy Practice, Conduct and Ethics, and the RCOT Career Development Framework, so that these can be used together to promote development of both OT practice and practice specific to critical care. This pillar is a product of a nationwide approach, seeking interested parties from the Royal College of Occupational Therapists Specialist Section, Critical Care Forum. A focus group with representatives from all nations was carried out to ensure each part of the pillar could be used within differing critical care settings and would work for OTs at various bands and different levels of experience within the critical care practice. Each person in the focus group then received a copy of the draft pillar to use with their team in order to give feedback via email, and all the comments were incorporated into the final document. Each member then received the document for final comments before being put forward to the RCOT Faculty of Intensive Care Medicine and the Intensive Care Society for endorsement. The AHP CCPDF is the overarching document. You should use this initially to benchmark yourself against the self-rating tool prior to using the OT specific pillar. The descriptors of the OT pillar are quite broad due to the variability of the critical care units nationally, and the descriptors can be interpreted within the relevant setting. Coming soon will be the National OT Critical Care Clinical Skills and Knowledge Framework, which will be specific learning outcomes for clinical practice within critical care. So let's look a bit more at detail in the content of the OT pillar. It's been split into two subdivisions. Initially, we have the quality service provision in the OT and critical care. This is about how you, as an OT, develop therapy in the critical care environment. For example, the assessment of patients' previous and current level of occupational performance, self-productivity and leisure. Secondly, we've looked at the development of OT within the critical care setting. For example, your education and training opportunities, the promotion of OT, evidence-based practice, and we also look at the national and international guidelines. These have been chosen as they are the most two important areas for OT practice, as this is a developing area within critical care, currently in the UK. Each of these two areas is split into 4 levels of development. We have foundation, specialist, advanced and expert. These development levels do not match specific bands or pay structures. To achieve a development level, you need to provide evidence. It is not necessary to do anything in each column to reach that level, and you should be using it more as a best fit, for example. This benchmarking can then be used as a tool to identify areas for development, to set appraisal objectives and to work towards the next level. At the end of the pillar is a self-rating tool which you and your supervisor can use to benchmark your current level to aid development, discussions and objective setting in supervision and appraisals. So just to summarise, you should be aware of how this document fits with the overarching AHP document. You should use it as a self-rating tool, use it in your appraisals and supervision to help direct discussions and learning opportunities. You can use our CPD ideas, which are at the end of the document. And just a reminder that competencies are coming. Thank you so much for listening. Good luck, and this will be reviewed again in 2025.